Reminder, reminder, reminder! The Delta State Contributory Health Commission wish to remind all pregnant women residing in Delta State to register into the scheme and get a health card. All children under 5 years must also be registered and get a health card before attending hospital. No health card, no free treatment. No health card, no free antenatal. No health card, no free delivery. This message is brought to you by the Delta State Contributory Health Commission.
Hello, thank you so much for joining us on the program Delta Health Insurance Scheme and You. I am Eunice Emiazia, your host. Well, in today's episode, we'll be bringing you, firstly, a news update of an activity of the Delta State Contributory Health Commission. After which, we'll bring you our main dish, which is the developmental strides of Governor Sheriff Oborevwori through the Delta State Contributory Health Commission. Stay tuned, and we'll be right back.
Delta State Contributory Health Commission. Africa yekaye rodi ebrubotore Delta. Ereso de bioto rawole ye bioyibo se health card. Emo le gbukuyan ipoto. IT so de bioto raibole ye bioyibo se health card na. Laise wo pe asare disi won ma. Obi be bioyibo se health card na. O mesi mo be oiro. Obi be bioyibo se health card na. Erubo te wode mlefu. Ofe oiro. Obi be bioyibo se health card na. Wode kevie ofe oiro. Delta State Contributory Health Commission.
182 indigent residents in Ojobo, a riverine community in Burutu local government area, have been registered into the Delta State Contributory Health Scheme, sponsored by Right Honorable Funke Keme Solomon, the Senior Policy Advisor to the Governor on Labor Relations and Savicom. Addressing the beneficiaries in Burutu, the Director General and Chief Executive Officer of the Delta State Contributory Health Commission, Dr. Isaac Apoveta, said the more agenda of the state governor, Right Honorable Sheriff Oborevwori, prioritizes meaningful health reforms for people in grassroots communities. Represented by the Director, Planning, Research, Statistics and ICT, Dr. Emmanuel Akpofure, the DG described Honorable Funke Keme Solomon as a public-spirited leader and thanked him for the gesture, even as he described the sponsorship as a testament to the spirit of shared responsibility in leadership. He reiterated the state government's dedication to breaking geographic barriers and ensuring affordable health care reaches the doorstep of its most vulnerable citizens. The Senior Policy Advisor to the Governor on Labor, Relations and Savicom, Honorable Funke Keme Solomon, represented by his brother, Oyako Rukumo Solomon, expressed commitment to do more. The Amanana Way of Ojobo community, Kopsin Ebipade, thanked the sponsor, urging more indigents to key into the initiative for the benefits of their community. The highlight of the event was the enrollment of the 182 beneficiaries. Ogenna Unduku reporting.
In your video, you may carry off your. Oh, when I know about Begwanari of your Delta State Contributory Health Commission Rose, I be carry off you, my Yabobi need dio, maybe your Ubroto, a Delta State, and why I hikero the reef yoto, Rena Agere or Bio, Uwimuna. Woti yomo noro ofefe rito ibiso yahikero dere fioto rena jere obio unwimuna rena asaro sirie evesibobi evobu imu woye ogbiwo obio unwimuna atisiwe oveve ogbiwo obio unwimuna wotera ye no dio atere rotuwe atisiwe oveve Wogbiwo obi wumuna wotera ye no dio no teye no atero no woye oveve he ovwana na otino obo ubroto no area of your Delta State Contributory Health Commission roroze.
Health, they say, is wealth. This quote is a true reflection of the reasons for the establishment of the Delta State Contributory Health Commission by the Delta State government in 2016. As a healthcare financing organization to ensure access to quality healthcare services for all residents of Delta State, irrespective of their socio-economic status and geographical location. Since Governor Sheriff Oborevwori assumed office in 2023, he reeled out the components of his moral agenda, which included the health sector, promising Deltans of a healthier state in line with which he appointed Dr. Austin Obidi as chairman of the Delta State Contributory Health Commission and Honorable Dr. Isaac Akpoveta, the Director General and Chief Executive Officer. 2 years down the line, the key role of the Commission in the implementation of the MORE agenda has remained visible as the Commission continued to implement its mandate under the formal, informal, equity, and private plans. The formal plan has seen civil servants across the state benefit from the health insurance scheme and saved the monthly earners from out-of-pocket medical expenditures during emergency health situations. The equity plan of the scheme has seen the state government, under the leadership of Governor Sheriff Oborowori, sponsor health insurance for all pregnant women and children under 5, year in, year out. This has brought succor to many families, especially in the face of high cost of medication and poverty across the country. The chairman of the commission, Dr. Austin Obidi, and the Director General, Honorable Isaac Akpoveta, speak further, beginning with Dr. Obidi.
They say, if the dawn will predict the dusk, Right Honorable Elder Sheriff F.O. Oborowori has shown that driving home the Commission's agenda for universal health coverage for all Deltans, that he will pursue it with uncommon resolve to make sure that come 2027, when we are looking at his scorecard for the first 4 years, people will say he came, he saw, and he did perform. We have a very virile media unit here in the commission. Very virile, I can say that for them. Who talented, forward-looking young men and women who are ready to work beyond the normal call of duty to send this message down to the grassroots. Health is wealth. The Lord of heaven and earth is admonishing us, exhorting and encouraging us to take care of our people. Let the rich take care of the poor. In Psalm number 41, verse 1, the Bible says, blessed is the man, I paraphrase to say, and woman who considereth the poor. He said, for God will answer him in the day of trouble. Trouble can come to anybody, rich, poor, high, or mighty. So when you reach out to the indigent, adopt them, God will answer you in the day of trouble. That's the message to our people. The scripture says, he will not forget your labor. That is when you adopt 100, 200, 1,000, according to your resources, God will remember it. It will be noted for you. You will benefit it in the here and in the hereafter. Your children will benefit it. And besides, you are giving back to society. A lot of our high net worth individuals are doing it. And my message to them is, God bless you. Keep it up.
We've been able, in this space of 2 years, move more than 1.4 million Deltans from the critical area of financing held from their pockets, which they don't have. They go on borrowing. Deltans of the vulnerable group, which form about 80% of Deltans. They borrow money. They sell properties just to care for them, for their health. But the government has taken over that, ensuring out of a 5.6 million population, in these 2 years alone, 1.4 million has been pulled out of that circle. It's a great human capital development. The law says resident of Delta State. resident, whether you are Igbo, Hausa, Yoruba, Anambra, Bayelsa person, Edo person, as long as you are living and staying in Delta and working in Delta and voting in Delta, we care for you. All in all, since the commission started, we have about 5.6 million Deltans. Going to 45% of Deltans have been enjoying one form of health insurance or the other. A very low cost, yet high quality care. And so the government have done well. The commission is the one carrying out those policies of government. And so we fit in very clearly. And the highest in the country, the number 2 person is just 1 million, 1.2. The state nearest to Delta is 1.2, we are 2.6 million. Our encounter level is well over 4 million encounter. Encounter means the number of people that have gone to the hospital, the number of times they have gone to hospital to receive treatment and paid for by this commission. Walk into the wards, inside the wards and laboratories of government hospitals presently. You will see beautiful new beds. Some years back, you get to the ward, you see plastered mattress, torn. And now modern beds, we call them 3-function, 4-function, 8-function beds. Courtesy of Sheriff Oborevwori.
Little wonder, women from across the borders invaded the health facilities in Delta State whenever their delivery date was due, just to enjoy the free healthcare, thereby overburdening the health workers. In a swift move, the Commission, in tandem with Governor Oborevwori's vision of sustaining the program, especially in the face of prevailing brain drain in the health sector across the country, mandated the registration of pregnant women and children under 5 residing in the state as part of the new policies of the Commission. This move helped in proper data collation, better planning, and resource allocation, while also reducing the burden of health practitioners in government hospitals and reducing infant and maternal mortality rates, as pregnant women enrolled in the scheme are regularly monitored from the antenatal stages till delivery.
The government say go and register free when you are pregnant and you'll be treated free. I appeal and beg all Deltans, go and register as soon as you are pregnant. Go and register your child. Don't wait until the child is sick. Get them a health card. Keep that health card in your pocket, and anytime you are feeling uncomfortable, go to the hospital. Government have made it possible to you to reach free care. No free food even in Freetown. But government agreed to pay for you. So why don't you take advantage of that? We must thank the government for that.
Those in the informal plan are not left out, as the state government subsidized healthcare under the plan to 7,000 naira per year.
Government is gracious enough to ensure that the premium to key into the scheme in Delta State is the lowest in the Federation. 7,000 naira. Pay 7,000 naira as a vulnerable individual, you access quality healthcare for a whole 1 year. The lowest in the whole Federation, none again. And so financial assets have been taken over by government. Government subsidized that 7,000 extremely to ensure that Deltans can come. Just come and write your name down with 7,000. And then the remaining treatment from everyday malaria, whatever it is, to admission, to cesarean section, to even heliography operations. Free antenatal care with 7,000 naira. So you can imagine the access, financial access that the government have granted to Deltans. And then we have the physical access. Delta is one of the only states that have so many health facilities in almost every village. Before you cross 2 villages of less than 2 kilometers, there's a health facility, at least a primary health care center. And then general hospitals everywhere. We have 11 medical zones in Delta State. Each of them about 10 general hospitals in each of the zones. Every headquarter of a local government in Delta State have a general hospital and a central specialist hospital. And so you can imagine the level of access. Delta State have about going to 460 primary healthcare centers. General Hospital about 660 something, going to 70 now. So physical access is available. You've given people money to attend, you've given them the location to attend. So the two components that is a barrier to accessing health in the world, financial access, physical access, Delta State government have provided it.
In line with Governor Borowore's inclusive governance policy, the Commission launched the Indigent Enrollee Adoption Initiative to give room for vulnerable persons who cannot afford the 7,000 naira premium to be sponsored by men and women of goodwill. To this end, the Commission mobilizes material and human resources, passing through difficult terrains, breaking distance barrier to ensure on-the-spot registration of the new enrollees into the scheme. Other ongoing unique strategies being implemented by the Commission to cater to the informal sector and the vulnerable populations are the Tertiary Institutions Social Health Insurance Program, which provides healthcare coverage for students in tertiary institutions, both on and off campus. The Artisan Enrollee Inducement Initiative, which allows artisans to pay their health insurance premiums in installments, and the Access to Finance Program, a public-private partnership designed to enhance accessibility and affordability of healthcare services in hard-to-reach areas. All these efforts put together have helped increase the number of enrollees to 45% of the state's total population, rating Delta State the highest among the state health insurance scheme nationwide. As expected, the scheme has attracted attention at different levels, leading to multiple awards for the state.
This commission has paid 19 billion naira into the health system in 9 years. Within this period of 2 years, Right Honorable Sheriff Borowo, the governor of the state, have released and paid 6 billion cumulatively from 2023 to present day. That's a huge amount of money. And when you invest that kind of thing, you must see results. You will see it, people outside will see it. So the award kept coming.
With the unflinching support of Governor Borowore to the Commission and the Commission's determination to ensure a more effective and efficient scheme, the Commission reflected on the impact of the state health insurance scheme and reviewed some of its policies. It announced new transformational policies including capitation, bundle payment, facial recognition encounter, as well as the aforementioned mandatory registration for pregnant women and children under 5 years. The Director General and Chief Executive Officer of the Commission, Dr. Isaac Akpoveta, explains further.
So we have a system called the facial encounter. If you want to take care, you just get to the hospital. Our agents, service monitors, we take your facial encounter, you smile to the camera, and it hit our server here. So when your bill comes, the two are married, and then the bill is paid. We also need to look at pay, the cost of care. Costs have gone up for quite some time. So the policy was from the board, increase the amount we are paying to providers to make them happy so that they can attend to our patients. So our capitation went up. We also devised the payment system from the conventional listing item by item. We changed it to what we call the bundle payment system. We define what you should pay for hypertension. If you take 4 drugs for hypertension, for example, it costs this amount. So we know that's the average amount. Anybody that goes to the hospital, hypertension, this is the amount to send. Another area of policy change has to do with redesigning even our operation in the system here. Before we came in, the bill system takes about 18 months to get a huge bill like from Arch processed. And so we came and I made huge files of 18 months, 10 months unprocessed. But I can tell you within the space of 2 years, we brought that down to normal cycle of bill processing in health insurance is 90 days maximum. But we're going to even shorten that with the new system we put in place now, that now the new policies as you are treating, because we have facial encounter, the bill hit our database, your bill can be processed in less than 1 week.
The chairman, House Committee on Health, Delta State House of Assembly, Honorable Ferguson Onwo, rated Governor Sheriff Oborowori high in the health sector, even as he observed the passion and commitment of the chairman of the Delta State Contributory Health Commission, Dr. Austin Obidi, the Director General and Chief Executive Officer, Dr. Isaac Amoveta, and others who partnered the commission in its effort at expanding access to health care for the vulnerable in the state.
It's the passion the DG and the chairman have attached to ensure that they succeed. Yes, they are putting their best, like I know, in ensuring that that place remains afloat. And they have been very innovative. So new ideas always come, but they try to see to ensure that the program is on stream every time. So I want to see the opportunity to commend the effort of the DG and the chairman of the commission in the good job they are doing. I also assure them of our legislative intervention anytime it is requested and required.
The Chief Medical Director of the Asaba Specialist Hospital, one of the healthcare providers under the State Contributory Health Scheme, Dr. Peace Ilosele, speaks on the impact of the scheme on the Governor Sheriff Oborowori's administration.
Being a governor in the past 2 years has done tremendously well, from approval for increased welfare for the doctors and other health workers to employments, which he has recently said we can go ahead with, to equipment, provision of equipment. Like I said, he has provided the hospital with a dialysis center, high-end dialysis machines that are latest model, top-of-the-end equipment, and these are not cheap. And I think that he has also provided the same for other hospitals and also other equipment like CT scans. And this has taken the quality of care we offer a notch higher. So during the course of his 2-year term, Asaba Specialist Hospital has done about 6 accreditations for residency programs. And we have full accreditation for radiology residency, which is something that few hospitals get within 10 years, 15 years of existence. But with his support, provision of all the required equipment, the hospital was able to get full accreditation for 5 years in radiology, in family medicine, pediatrics, and these are achievements that are a plus in terms of training, because with training, we're able to have our own homegrown specialists so that we can replace those who are leaving and have a ready supply of specialists to all the hospitals in the state. He has approved the payment of medical residency training fund to every resident doctor in the states, and it's about ₦1 million for every resident doctor per year. So this has encouraged more people to work with the states and has encouraged more people to go into residency programs. And then he has also given us approval for replacement of staff who leave the system. So we know there's this ongoing JAPA syndrome. So but with the approval given to us to continuously replace anybody who leaves, it has helped us to always close the gap whenever people leave. So the commitment he has shown shows that he's really concerned about the welfare of the citizens and the health of the society, and I think that is laudable.
For Dr. Amoveta, he believes the road to achievement is built on consistency and paved with efforts. He attributes the achievements of the Commission so far to the consistent support of Governor Sheriff Oborowori, who has demonstrated passion and commitment to bringing more dividends of democracy to the people.
So the first thing that makes this success story, whatever award we have gotten, you see them, is government. The strong political will of the former government and the present government. And that is why it is important for continuity in government. And I must thank the near past governor and the present one for that unity, for that creating that situation in Delta State. And also cascading into the commission. Management is to be appreciated. The board should be appreciated. On their shoulder I stood and I achieved what we are achieving. And so Deltans, Sheriff have done very well. Support him even with your own contribution. Buy health insurance for the poor. Because the mosquito that bite the poor will come and buy the rich man. And death doesn't know the rich or the poor. And so, take care of people around you. According to the more agenda, give more to everyone around you. If we put all this together, Delta will be a greater state. And this is what I advocate and advise all Deltans.
With over 5 million Deltans registered in the health insurance scheme and barriers to healthcare accessibility already being broken through the numerous transformational policies of the Delta State Contributory Health Commission, coupled with the Governor Sheriff Oborowori administration's resolve to do more, there is no doubt that Delta State would achieve the universal health coverage with its attendant benefit accruing to all citizens. We can achieve this. Yes, we can.
The Delta State Contributory Health Commission, they don't come again to remind all pregnant women when they for inside Delta State to say may they go register with the Delta State Contributory Health Commission scheme and get their health card. Even all pikin when they for 0 to 5 years must also register and get their health card before they go get any kind of treatment for our hospital. Because from now on, it go be say no health card, no free treatment, no health card, no free antenatal, no health card, no free delivery. Now the Delta State Contributory Health Commission, now they bring on this ogbonge tori.
That's it on the program, Delta Health Insurance Scheme and you. I hope you had a wonderful time. Join me again next week for a fresh package. I am Eunice Emiasia. Bye for now.